Thank you. Ms. Jenkins, you're recognized.
Thank you, Mr. Chairman, for holding the hearing. Thank you, Mr. Miller, for joining us. I want to return to a discussion Congressman Smith started with you and discuss the issue of rural hospitals and some of the closures. MedPAC's March 2015 report addresses the rural hospital closure crisis and finds that rural hospitals represented 44% of all closures. The report finds that the closed hospitals are an average of 21 miles to the next nearest hospital, yet the report does not specifically address the issue of access to care in rural America. My congressional district has a number of these rural hospitals, and the state of Kansas has 83 critical access hospitals, more than any other. These hospitals provide excellent care to my constituents, and without them, my constituents would lose local access to care. When a patient has a heart attack, 21 additional miles of travel makes a difference. So my question is, has MedPAC considered the impact of access to care for rural Americans if and when these necessary safety net providers close?
So, my answer would be yes. Each year we assess access, quality, capital markets, costs and payments, and a number of factors in setting an update payment for the hospitals. And I can't remember if you were here when I was talking to Mr. Kind. The Commission for the last couple of years has made positive payment updates for hospitals the last couple of years. Over 10 years or longer even, the Commission has made recommendations with respect to rural payment that have increased payments to rural hospitals trying to address some of the issues that you raised. Now, all that said, I also want to say something else, which is in 2012, the Commission did, and this was an exchange I believe I had with Mr. Smith, which was when you think about the supports, think about, how, and particularly the Congress is always working with a limited dollar, think about where that dollar is going to make the greatest difference. If you just say all increases to all rural, you're increasing payments for a hospital that sits right next door to, an urban area and a hospital that's 50, miles out on a hilltop. And so there are other ways to think about how the support is provided. And the other thing I think is just a fact of life, and it's for urban and rural hospitals, but to Mr. Smith's point and to your point, it can mean a lot more in a rural area, is if admissions continue to fall, these hospitals, urban and rural, are going to have to rethink their mission. And an idea that seems to be floating around some of the urban or rural areas, that I've talked to people about is the notion of whether is it a full inpatient hospital that you need at that point, or do you need something more like an emergency room, urgent care type of thing? Because your point is a heart attack to go 21 miles or 20 more miles. I get your point, but what about a routine inpatient hospital service if in fact the admissions are declining? It is going to be struggle for hospitals, and particularly for rural areas, to support hospitals if admissions continue to decline.
Okay, I agree. Another study I saw from the National Rural Health Association, it reports that 283 additional rural hospitals are on the brink of closure, just shutting their doors. And this means, for these communities, they're not going to have the comprehensive local care that they need to survive. And of course, I think you understand when rural hospitals close, there's a domino effect. And employers are affected, communities, families, and the like. Just quickly, where are folks that call rural America home receive needed health care? Where are they supposed to receive the needed health care if we see these rural hospitals closing?
I think it goes back to a point that I was making a minute ago, which is, again, how many fully comprehensive hospitals do you need for any given set of miles? I absolutely agree that you need some set of comprehensive care, but if we are supporting hospitals that are in rural areas that are very close to one another, And a question for the Congress, particularly with a limited dollar, is if there was a consolidation there, one hospital, it might be more financially viable, it might have higher quality, and it could be that we need to have these conversations about a different community saying, okay, they'll have an emergency facility, and this, you'll have some consolidation for the hospital, and then an emergency facility to serve where you don't have a full hospital. Sorry.